So I'm going to start with the observation of the head and face. So you're going to start with just looking, general scan, looking at the head size and shape, looking for any asymmetry in any direction, and then you just scan. You can either scan top down or bottom up. So then I'm going to look at the shape of the eyes and eyebrows, looking for any lateral thinning in the eyebrows, looking for any outward flaring or inward flaring eyelids, looking at the color and the distance between them, looking for any obvious signs of infection, any redness, any pus, anything like that. Then go down, look at the nose, looking for any nasal flaring that would indicate respiratory distress. Then down, looking at the lips, looking for asymmetry, any scars, any cracking, any signs of infection, vesicles, anything like that. And then just overall looking at the skin, looking for any blemishes, any rashes, anything like that. And it all looks good. So then I'm going to, I'll have you turn and face that way. Then I'm just going to come back and I'm going to evaluate the scalp. I'll be wearing gloves just in case, looking for any nits or anything that would indicate like lice or like bed bugs or anything like that. Also looking for any scars on the scalp or any blemishes, any odd shaped moles or anything like that. And then I'm just going to feel around on the scalp for any bumps under the scalp, on the skull, any changes, anything like that. Let me know if there's any pain with any of this. Okay, and then I'll move to the front and I'm going to put some pressure on your frontal sinuses. You just let me know if there's any pain with any of this. Make sure coming down the bridge of the nose just a bit. Nope, and then we'll go across the maxillary sinuses. Any pain with any of that? Nope. And then I'll feel the parotid glands, feeling for any enlargement, which would indicate signs of infection, especially if it's bilateral. That would be a big red flag. Okay, and then I will just do some special testing for cranial nerve 7. So we'll start with sensory. So typical to any of the sensory tests we did in the arms, I'm just going to have you close your eyes. I'm going to brush my fingers across your face, along your forehead, down your cheek, and then down your jawline. You let me know if it feels the same or different. Same. Okay, and then I'm going to take a sterile Q-tip, which I should have prepared before. Do you want me to open it? Yeah. I would not ask my patient to do this. Okay, I'll take one of them and I'm going to just pull at the end of it a bit to get a little wisp.
So hard to pull with the gloves on. Like you can't do it without gloves.
There we go, you just need a few little strands. I'm going to just have you stare straight ahead. I'm going to brush this across the corner of your eye and I'm just looking for you to blink. And she blinked, and I would do that bilaterally. And if there was indications of infection, I would use a different cotton swab. And then for muscle testing, I'll have a sterile tongue depressor. And I'm just going to put this on each side of your mouth between your teeth. I'm going to have you bite down and hold, and I'm just going to give a little tug just to test your jaw strength. Good. And then I can take off my gloves at that point. And I will use my stethoscope and use the bell to listen to both the temporal artery and the orbital artery.
So an easy way to check if it's open is you can look in it, and when you turn it, see that's
closed.
Gotcha. And someone taught me that in lab, and I was like, oh, cool.
And using the bell, you will just lightly place it over the artery. You don't want to leave a ring. Okay, and then I'll have you close your eye. And then the other eye. And you're listening for any whooshing sounds that would indicate a bruit. If you hear a pulse, that's okay, and if you don't, that's also okay. Sometimes you can hear it and sometimes you can't, as long as you don't hear a whooshing sound. And that's it.